Hi, my name is Rosie Ross. I'm a student at Cedar Crest College, and I'm here to present to you my evidence synthesis related to my PICO question or research question. In preoperative adults, does listening to music reduce anxiety? Anxiety is very common in the preoperative environment, and most patients are given a sedative or an anti-anxiety drug. The effects that anxiety can have on your body is it can increase the heart rate and the blood pressure. It increases blood cortisol levels. It can increase the risk for infection. It can increase the time needed for healing, and it can increase the analgesic requirement, which would all prolong recovery. Now, music has been known to have an anxiolytic effect by suppressing the sympathetic nervous system. It also triggers the limbic system to release endorphins, which promote and enhance well-being. In my evidence search, the databases that I used were PubMed, CINAHL, Medline, and Google Scholar. The keywords that I used were preoperative, surgery, anxiety, stress, and music. The filters that I used were 2009 to 2015 and humans. Out of the results generated, I chose a Cochrane review, and then I further narrowed my results by adding articles added within the last year. That generated 8 results. I read those, and I chose 2 clinical trials. The Cochrane review, they chose 26 studies with 2,051 patients. They were random controlled studies, random controlled trials, and controlled clinical trials. The instruments used were the State Trait Anxiety Inventory, Visual Analog Scales, the Zung Self-Rating Anxiety Scales, and numerical rating scales. And the evidence that they came up with was that music listening resulted in anxiety reduction and also a small decrease in heart rate and diastolic blood pressure. The first study that I chose also had evidence that music decreases anxiety. This study was in women undergoing gynecological surgery. And it also showed a significant reduction in heart rate and systolic and diastolic blood pressure. The second study that I chose also showed evidence that those who listened to music had a significant decrease in anxiety. And in this study, it was interesting that those with the highest anxiety preoperatively showed the greatest decrease in anxiety. The recommendations are that music intervention be offered as an alternate to preoperative sedatives and anti-anxiety medications. That music centers can be established in hospital facilities, and that musical intervention is an inexpensive strategy that could improve the environment for both patients and staff. For future research, the recommendations were to examine the types of music and the effect that different types of music would have on patients, and to study if providing a choice of music to the patients would make a difference, that they could listen to their choice of music, and also to study the optimal length of time of listening to music. And that is the end of my review. Thank you.